Hi, Katie. I'm Dr.
Hi,
Casey.
nice to meet you.
How are we doing today?
Doing okay.
You're doing okay? Okay. Tell me a little bit more.
Well, I'm having some issues with my belly button.
Your belly button.
Yeah.
When did this start?
It started a few weeks ago.
Okay.
Yeah. I'm just having like bouts of tingling and like a weird sensation when I press against it. Like it feels
Okay.
very, very sore.
Okay.
And only when I press against it. So it's almost like a nausea feeling.
Okay.
But only when there's pressure.
Okay.
Yeah.
Interesting.
Yeah, sometimes it gets red too.
Okay. Just inside the belly button or around it?
Around, there's like a ring of redness that will show up if I really like irritate it.
Okay. Absolutely. And no medication that you're taking currently or anything?
I'm taking trazodone at night to
Okay.
sleep, but that's something I've been taking for years.
Yeah.
So
Should not be related to that. And no known allergies?
not that I'm aware of, no.
Okay. And no recent surgeries?
No.
No. Okay. And do you feel this tingling sensation anywhere else in the body or just the belly?
You know, my hands get tingly sometimes too.
Do they? Okay.
Not red, but they sometimes almost like carpal tunnel, like it's difficult to move and they just feel kind of painful and tingly.
Okay.
Yeah,
Sorry to hear that.
Yeah.
And do you find that they happen around the same time?
No. No.
Okay.
Yeah, very different times.
Very different times. Okay. Very interesting. And is this a constant or does it come and go?
It comes and goes. Yeah, I would say that the belly button issue is the worst in the morning.
Okay.
And that the hands, like, honestly, probably at night.
Yeah.
Because I think it might be due to me using my phone a lot, like,
Okay.
typing, maybe that's why. I use my phone a lot during the day, but that's my only guess.
Interesting. Yeah. Okay. So I'm thinking that they have some correlation to each other and it's just affecting you at different parts of the day on the different areas. I'm thinking it's something more gastro that might be going on that's inflaming your body and interconnecting. So we'll do an assessment and from there we'll kind of get some treatment ready to go for you, okay?
All right. Thank you.
Thank you. Have you go ahead and lay down on the bed.
All right.
I'm going to go ahead and start with a visual assessment of the skin in the area. Okay. My visual assessment, skin looks clear as of right now. Normal color and warm to touch. Not noticing any bumps or bruises, lesions. Belly button looks clean, no signs of fungus or moist. It's pretty dry. I'm going to begin palpitations just to track the density or pressure around the stomach area. At any time, if you feel any pain, please let me know. They are light palpations, so it shouldn't cause too much discomfort.
Okay. Kind of right there it hurt.
Right here.
Yeah, when you went directly above the belly button.
Okay.
Yeah.
I do actually notice tension in this area.
Yeah.
And what I'm feeling here, I notice that tension up to here. So I'm actually going to go ahead and measure this. Okay. So 5 inches, right kind of where your rib cage ends and the start of your belly button. Good to know. I feel a little bit here as well. It's not as big. I'll measure that. Okay, just 1 inch. This side actually feels pretty good. Feel it extending out to here. Let me measure that. 5 as well. Okay, so we are getting a radius from the belly button extending out at about 1 to 5 inches of tightness underneath the muscular tissue. So I think we have some inflammation. Do a further inspection. It's definitely underneath the muscular tissue. So a little raise on this one here. Everything else is a smooth surface. Belly button does look healthy again. It's actually not as much moisture, it's pretty dry. So I'm going to apply a foam to provide moisture to the area. we're just gonna spread it over the area that we're having discomfort. A good sign is that the foam did settle in and provide hydration. It did not create any color to show concern of fungal or lesions in the belly area. It's definitely interior concern of our body. I am going to go ahead and clean the belly button. I'm going to clean the belly button. Just take a sample. Okay. We did have a little bit of dirt come out, but that is normal. To ensure that it is just dirt, we will add this to our testing tube. Looks like a little piece of skin that did come out. So we will also just add that to our testing tube. Ensure that it is just dead skin cells. And just a swab in the belly button. Okay, and we will moisturize once again. tapping. I am thinking that we are having some gastro inflammation in our tendons, causing the belly button area to periodically become inflamed. It's creating this tension and pressure here for you. I think that is slightly related to your hands tingling. I also think that your hands, since you use them quite a bit for work, are kind of a separate issue on their own that we will address. I'm going to do some massaging and cupping on your stomach to help alleviate inflammation and pressure, allowing things to move, get the lymphatics drained, lymph nodes drained, and then we will move on to reflexology in the hands, which will not only help with the hand tingling and sensations, but it will also help target the stomach area by utilizing our zones with our reflexology today. So,
Okay.
awesome. Before I begin with treatment, I just want to double check that we are feeling everything normally. So I'm going to do a few tests. First, we'll start with a hard or soft test. This is hard and this is soft. Can you feel the difference?
Yes.
Okay.
Hard. Hard. Soft. Hard. Soft. Soft. Hard. Hard. Soft. Hard. Hard. Soft. Soft. Hard. 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 Soft. 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 Hard. Hard.
Perfect. We were able to evaluate and differentiate between hard and soft. We're going to use another technique. We're going to do another test to ensure that we are able to feel everything evenly throughout and that our sensory system is working to just kind of rule out anything else that it could potentially be.
Okay.
So we're now going to begin with a warm and cold test.
Okay.
This is cold. This is warm. And we'll begin.
Cold. Warm. Cold. Warm. Warm. Cold. Warm. Warm. Cold. Warm. Warm. Cold. Cold. Warm. Warm.
Perfect. And we will complete it with one other test, which is dry or wet. This is wet. This is dry.
Okay. Wet. Dry. Wet. Dry. Wet. Dry. Dry. Wet. Dry. Wet. Dry. Wet. 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 Dry. Dry.
Perfect. Wipe off the wet. Okay. No concerns other than I think we have ruled out everything. We are having inflammation of the intestines and it's causing gases to push everything out and affecting your belly button area, which is why it's occasional and why you're only getting it at certain times.
Okay.
Especially after you've been sleeping and your body is resting.
Yeah.
And then you're waking up and it's getting everything activated and ready. So we are going to start with our treatment, doing some cupping and massaging, and we will move into your hands.
Okay, thank you.
Yeah. Are you comfortable right now?
Yes.
Okay, thanks. It's okay. I'm going to pull your pants down a little bit.
Yes, yeah.
Going to begin with massage oil, which will help relax the muscle. That way we can penetrate the area that we are working on today and allow your body to relax. So that way when we're doing the treatment, you are not as sensitive. going to begin with a light massage just to awaken the body and ensure for deep penetration when we go into cupping. We are creating circulation in the blood flow using cupping, trying to allow space. I'm going to put these right on the areas where I felt most tension. Beautiful. I'm already feeling a release. We'll begin with our massage techniques. I have more oil. We're going to go ahead and bring in some lymphatic drainage here. I'm thinking it would be beneficial to take probiotics, which will help with the inflammation of the intestines, allowing enzymes to actually break down the food through the gastrointestinal tract and allowing the body to process regularly. It will also help with the inflammation, which should result in the clearing of pressure and redness around the tummy. Probiotics are great to allow good bacteria to maintain healthy while eliminating an overrun of bad bacteria. As we're doing this, it does help the digestive tract to begin its process. It awakens it. And with this cube, we're going to hit where those tense spots were as they're slowly alleviating. You will feel sore about a day or two after doing this treatment. However, as soon as those 2 days are up, you should feel a relief. You won't feel as bloated, you won't feel tight or pressure. And taking the probiotics will really help maintain the good bacteria and allowing your body to process naturally. And it won't interrupt your sleep or the medication that you take, so you can presume that as normal. Beautiful. Our treatment for our stomach is complete. We will move into our hands. Go ahead and begin assessing your hands. They are cold to the touch. mobility is there. Feeling the bones. No misalignment, no fractures. Alright, I'm doing some checks. A reflex back to normal in 0.2 seconds and return to normal color. Veins look healthy, no eruptions. Does it cause you any pain when we're mobilizing these fingers?
In the thumb and the pointer finger, it's a little bit just tense and sore.
Okay.
Yeah.
And everything is the same with this hand as the other. I'm going to go ahead and put on some reflexology gloves, which will help massage out your hands. I'm wondering if we have a pinched nerve somewhere, which is causing the tingling since you're in the same position all the time using your thumbs and fingers.
It's a possibility.
Yeah. And the great thing too about our hands is that it actually mimics our internal body organs. So as we're assessing the hands, it will also help with what your stomach has been going through. So we're kind of two birds with one stone. Yeah.
That sounds really awesome.
Yeah. We'll put these gloves on. This is for your left hand. Beautiful. This is for your right hand. Perfect. First, I'm going to use a thumbing technique. We're going to start in zone 1, which includes what our head area would be. So our sinuses, head, and neck. Okay. We're not going to spend too much time in zone 1 since that's not our area of concern. But it is still good to hit every area to ensure that we don't miss anything in your treatment. Go into the head and moving to the neck. We'll go ahead and do the spine here. I'm just kind of moving back and forth from hand to hand, assessing the same area at the same time. Awesome. Now we're going to go into zone 2, which includes our thyroid and right near our shoulder area. First, doing the thyroid, then shoulder. We have our lungs right here. And on this side, thyroid. Lungs. And shoulder. And on this hand, I'm actually going to pull out my massage tool and begin the other zones. I'm going to use my massage tool to get a deeper massage in the reflexology, since it also triggers your stomach area. So I'm going to begin with the liver. Then we have our solar plexus. Our stomach, which is the most important. And you know what's so funny? Is if you look at this glove, you can see your thumb and your finger, and your stomach is right here. And so as you're using your hands with your phone a lot, it's actually really targeting that stomach area, so it could have some relation to what you've been feeling.
Wow, that's amazing.
Yes. So we'll continue our massage, get you on probiotics, and just get your body back to
Thank you so
normal.
much. I didn't realize that.
Yeah. No one really does, you know?
Yeah.
I think it'd be great too to just provide some daily exercises, which will help in stretching and the mobility and just really opening things up. So that way we can prevent this in the future. And get your health on track. So now we're by our kidneys. You're going down to the bladder. Our colon. Our small intestines. And our gland insomnia point. Okay, your right hand is complete. We'll finish with your left hand. We'll do our heart, lean. Solar plexus. Stomach. Kidney. Down to the bladder. The colon. Small intestine. And our insomnia point. Beautiful. Going to do a quick massage of the hands. Now that we are finished with our reflexology, I will just end with a quick hand massage.
Okay.
Okay. Katie, we are all set with our treatment today. Again, I'm going to prescribe a probiotic for you to start taking. You could take it either at night or in the morning, whatever works best for you.
Okay.
Just one per day.
Okay.
Once we start the probiotic, I will have you follow up in about a month just to see how everything is doing. Of course, if you feel like anything is worsening, please give us a call before then.
Okay.
But you are all set for today. How are you feeling?
A lot better. My hands feel so much more relaxed.
Good.
And my belly button pain has definitely subsided. So
Beautiful.
definitely.
May that continue.
Yes, yes.
Thank you, Katie. It was nice to see
All right.
you.
Thank you.
Bye.
Bye.